for this meeting. And starting now, the meeting is recorded. So for everyone's information, and also so that you're aware, we'll have a link available so that anybody who would like to watch this and can't make it today is welcome to do so. Another part of housekeeping before we go further, I want to make sure everyone knows the point for today is to have this be as interactive, informal, really information sharing so that we have a discussion, not so much of the presentation. We were thrilled to have our national speakers with us back in June, but today we'll really hope that we'll have a chance to share perspectives, information, and consider next steps together. So if at any time we're going to have a brief introduction from our colleagues here that recap some of the new information about unassigned albuterol in Texas, don't feel like you need to wait till the end. Put your hand up, put it in chat, and we will make sure that we get the discussion going as we go forward. So I will briefly take a moment to introduce our panel. We have, I am delighted to have Becca Harper-Road from Texas School Nurse Organization, our advocacy chair, as well as Charlie Kagan from the American Lung Association. And together we have, with other partners around Texas, had a wonderful experience having a chance to hear from people and connect on unassigned albuterol during the last legislative session. I know a number of people came out and were involved on Nurses Day on the Hill or connecting with their legislators. And now we get to start that exciting work, that next step of the journey of implementing this and making it a reality for more individuals and for schools. So with that, I've got two quick questions to help get everyone else introduced. Since I'd love to go across our group, it won't have a chance. And we're just admitting we've got a couple more people who are joining now. As we do that, I want to ask, I believe there is a poll launched. I hope everyone can see that. And it just asks who is attending here today. And I will be able to answer that, and we'll see those responses. That would be wonderful. So again, for the couple of people who have just joined us, we've got people are coming in on an ongoing basis. Thank you all so much. But yes, we're recording today, and please take a moment just to what your goal is with children and community health.
If for some reason anybody's not seeing the poll, if you want to just type in the chat your name and what area you're from and what role you play, whether it's in school, in the community, in healthcare.
Wonderful. So we have got, I think just about everybody has been responding. Thank you all so much. About half of the people are school health administrators, and so welcome. Thank you. We really appreciate your perspective. We have one school administrator, and we know that this is such a partnership. We have to get everyone on board. Thank you so much. We have 10 school nurses, an educator, teacher, and another community member in a group not mentioned above. So thank you all so very much. And I'm going to ask one other question, and that is just briefly, you can, with a quick show of hands perhaps, how many of you all were on the forum that was held in June when we had our national speakers with us? And maybe just a quick show of hands, that would be fabulous. Yes, okay, so a few people, but we have a lot of people who are new as well, and we are thrilled with that. Thank you so very much. So with that in mind, we will go ahead and just get started from there. And Charlie Bacon is going to get us started by talking a little bit more about the legislative history and how we got to the place we are today with unassigned albuterol legislation. Thank you, Charlie.
Thank you, Leslie, and thank you all for joining today. This new law in Texas is a result of many years of hard work from many partners. I'm sure many of you all are on this call, and they all relate to changes to the education code. So for those who want to do a further deep dive, I've listed there on the side which chapter of the education code all of this falls into. But back in 2015, there were no asthma laws for schools. There were no epinephrine laws for schools. And fortunately, that was really when the conversation began. So in 2015, there was a bill to allow the use of epinephrine autoinjectors on public school campuses. And it was a little bit controversial. There were 6 Senate no votes, and some of those no votes are now the leaders in the Texas Senate. But lawmakers quickly saw the benefits of this policy, and just 2 years later, expanded that policy to private school campuses. That was a unanimous vote in the Senate and only 4 no votes in the House. Fast forward to 2019 is when we started to join the conversation around the prescription asthma medicine. And so that law in 2019 specifically added prescription asthma medicine for public and private school campuses, but it was very limited, and specifically it was limited to students with an existing asthma diagnosis. So think about the kids who, may forget their asthma inhalers. And it was limited in terms of who could administer that asthma medication to only school nurses. Now that obviously was a great improvement. We all know how kids can be with their inhalers, but it left many students, particularly those who might experience asthma for the first time, without a crucial tool. And the reality, as we learned, was that schools essentially had to call 911 and wait when they had a student without an asthma diagnosis who experienced respiratory distress. So in 2021, during the pandemic, we started the process of trying to expand that policy and at least allow public schools to administer this when there was not a school nurse. And unfortunately, that bill didn't make it quite all the way across the process, but at least we were continuing that conversation. And so when we began in 2023, we initially thought, we can kind of chip away at this law and try to slowly improve it, or we should go for the whole shebang. And this was based on new guidelines from the Lung Association and many others that recommended expanding the policy to any student or really any adult on the school campus who might experience respiratory distress. And we all know that the unfortunate reality is that many schools in Texas do not have a school nurse on campus every day of the week. And so fortunately, in 2023, we were successful. Senate Bill 294 and its companion House Bill 920 passed both chambers with unanimous support, and it will soon be law starting in September. So we can go on to the next slide. And before we kind of clarify what this new law does, I want to reach out and thank all of our many supporters from the organizations such as Texas Society for Respiratory Care and the Allergy and Asthma Network, who provided letters of support, to the many individuals who came out and spoke in person during committee hearings, but also registered comments. And as you can see here, there were many people happy to weigh in on this, including several organizations that we didn't even reach out to, but that saw this great policy and wouldn't put a card in support. And I particularly want to thank Drs. Dan Dean, Becca, Leslie, Dr. Shadea Falabe for coming out and testifying during the committee hearings and lending their unique perspectives and experience and really answering a lot of lawmakers' questions about the reality of this policy and how it will save lives. We can go on to the next slide.
Right.
And so now I'm going to hand it off to Becca Harkleroad, our resident school nurse expert, to really explain what this bill does and what the changes are and what they mean for schools.
Thanks, Charlie. I think you did a really good job of covering the history and how we got to where we are. And I just want to go over one more time as a reminder what Senate Bill 294 does, what it actually allows schools to do. So like Charlie said, it allows us to administer albuterol to anyone with respiratory distress symptoms, regardless of whether or not we have a diagnosis of asthma on file for them, especially in the Texas Hill Country during cedar season. We have a lot of kids who experience respiratory distress when they're outside at recess or something like that. They may not have asthma, but they sure are having a hard time getting air. It also is going to allow us to train non-nurse staff to recognize the signs and symptoms of mild, moderate, and severe respiratory distress and respond appropriately, including administering stock albuterol. One thing that has been a barrier for implementation for a lot of with the stock epi laws that we already have is the requirement to have stock epi available anytime the door is open. So Senate Bill 294, the version that we got passed, actually only requires this to be available during school hours, which the legal interpretation of that is loose, but it's around two things, either bell to bell or within 30 minutes outside of the bells on either side. So if the front office is open, we consider it regular school hours. It also would allow folks to administer outside of those hours or during school sponsored trips, you know, a lot of band trips, a lot of sports trips. If campuses or if school districts are able to send stock albuterol on those trips to keep those kids safe as well, anybody who's trained is allowed to administer there as well. So earlier in June, we talked about what it looks like when we go from a law to a policy. And I'm going to go over that really quickly. So Senate Bill 294 is going to make changes to Texas Education Code, Section 38, which is kind of where a lot of school nurses live for health and wellness, and TEA and DSHS.
Oh, they've already started. Are you in?
I don't know if I can mute anybody. Any changes that are made will change the rules through DSHS and TEA. And then TASB is going to take the new rules and turn it into a board policy. So it's going to have to be voted on by your board. The legal policy will be the same across the state of Texas, and then your district will make its local plan. So those are all things that need to happen on the paperwork side of things, right, before we get started. And once we go that far through it, then we're going to start getting a little more personal and talking about what works best for your school district and what that's going to look like, everything from training to implementation. So Leslie, if you want to push us to the next slide, we'll talk about those things, right? Like I said, we have the bill that was filed that's going to change the legal language in Education Code and Texas Administrative Code. And then your district will adopt it as a policy. So you want to be able to communicate, collaborate with your school board about when this meeting is going to take place, who, you know, what those details are going to look like. How are we going to get it on the books that this is something that our school district does, including and especially notification that this is something that your school district is going to do. So you're going to need to work on that part. And then the next thing you need to do is decide on training for your district. Who is going to be assigned to do the training? Who is going to be assigned to administer this medication? When and where do y'all plan on doing the training? What paperwork will employees need? These are all very small little logistical steps that are all important and all need to be considered before we make this happen, right? Documentation and every step of the way, document the training, document the people to do it. How are we going to document when we give it? How are we going to document any improvement or, you know, what's reporting going to look like for our school district? And then of course, obtaining the product, right? You're going to especially in the wake of COVID, when we just completely did away with NABs at school. All the emerging research from pulmonologists also says that for this purpose, that an albuterol inhaler with a spacer is the way to go for implementing this policy. So you'll need to be able to get your hands on those meter dose inhalers and disposable / reusable spacers. And once you get all of those things figured out, it's time to really talk about implementation and actually make sure that once you have all these decisions made, now you've got to make sure all those things happen, make sure all your campuses have everything they need, the tools, training, and the confidence to respond in such a way that they're going to be able to help save a life using this law that just passed. And I think that kind of covers all the step-by-step. Leslie, I am going to hand it right over to you.
Wonderful. Thank you so much, Becca. I'm going to ask one question just as a point of clarification. And that is with the law that making it available to those off-campus events, that is permissive, correct? It isn't a requirement. And I think with a lot of these elements of the law, they are what we call permissive rather than a requirement. And I think that in itself is going to be a big relief to a lot of folks. I also want to thank that there's a number of people who have joined who I know are a part of the Asthma 411 consortium and partnership up in North Central Texas. I want to recognize really quickly Courtney Barnard at Cook Children's is on the call. So thank you so much, Courtney. And yay, thank you. We also have Sarah Hillman and Rachel Rivera. These are folks who have been engaged in implementing the unassigned albuterol for really a number of years now, along with our partnership. So I'm going to, Rachel is one of a wonderful nurse in Northwest ISD, and she's been developing an outreach and education program to follow up, especially for all kids with standing delegation order use and with asthma. Little lungs, big deal. Right, Rachel? Yes. And then Sarah Hiraman is among the administrators at Arlington ISD. So again, we've got folks with a lot of experience, and I hope everybody will chime in as we go forward with our conversation. And if I'm not seeing anybody who has joined from our initiative, of course, my apologies, please also. So I wanted to let folks know just a few of the resources. As Becca mentioned, there's a lot of moving parts, and we know that can seem very daunting as you get started. The good news is that you do not need to start from scratch and create everything on your own. And I am affiliated with UNT Health Science Center and Safer Care Texas, which is a patient safety initiative funded by the state. And together with our wonderful partners, Cook Children's Center for Children's Health, JPS Acclaim, and also our 10 school districts here in North Central Texas, 350 campuses. We've been doing this for some time now. And we have, when we went through the pandemic, we realized there was a huge need to put everything online. When the 2019 legislation was passed, we recognized people needed all of these tools. And although some of those were, well, they were terrible challenges in their own way, especially the pandemic, what we ended up with is these tools are online and they're freely available to folks who would like to use them. And we're going through a process right now of revamping and revising all of the content so that it will align directly with the new legislation. So I am going to go ahead. This is a screenshot of our website, and I'm going to go ahead and select the Asthma 411. And we'll just do a quick opportunity to explore some of that content. It may take me a little second to get over there, but we're going now. You can see we're coming right there. And I just invite anybody who is interested in the resources. You can just join asthma411.org. And it is available on your phone. We have the about, which gives a little history of asthma 411. I'm not really going to get into that beyond mentioning that we've been drawing really on 20 years of experience with unassigned albuterol, going back to controlling asthma in American cities. And that is when the asthma 411 model was developed, basically taking our wonderful recommendations for school asthma services and making sure that unassigned albuterol was part of that program, to have that access to quick relief medication. We have the nurses and health administrators. We are in the process of updating our CME right now. Monday and Tuesday, we ended up recording new videos so that we have all the pandemic related content is being retired. And we're working with revisions so that it will more directly align with the new legislation. If you select this administering, you'll see we divide that in. We have the light air space or training videos. Our standing delegation order is here as well. And these are templates that you can download and you can adapt them to your school district's needs. We have a quick reference guide. I sometimes call it toolkit, the one-page toolkit that links to many resources, including the videos. I'm not, there you go. It has the algorithm, a skills checklist, it'll link you to your state reporting form, the asthma visit reports, a frequently asked question. This is the last one I'll just mention and go to. This was responding to a need that nurses let us know about. How is there a concise way to put something in writing to tell parents what had happened today and what they need? So we have this along with the asthma visit report that allows just a checkbox so that you can see what were the symptoms, what was done, what's the recommended follow-up. All of that's required in the legislation to go to the family, and also we can ask the family to take that to the department. As we go forward, then these can be all adapted for your district, but we really invite people to let us know how they're using it. And one of our next questions will be, okay, these are some great resources, or we hope they're helpful, but what else do you need? Because we know we've kind of done this while districts had already been working for a number of years, and there may be a lot of elements that we still need to develop. We want to get, for example, a sampling policy up here. We're working on a CME that would be available for your authorized prescriber or a physician, and additional content with them. But anyway, here's the follow-up and documentation resources. And there's a number of other resources: avoiding environmental triggers, asthma self-management education, parents and caregivers. All right. So with all of that in mind, I want to take an intentional pause, first of all, and ask, are there any questions or comments from anybody right now on the call? And I'm also going to go ahead, and while we take a moment for people to do that, I'm going to open up our next poll and just say, what resources would be helpful for you? And this is just a short answer. I've just selected launch. And if there's something that you think would be really helpful and you don't see here so far, let's just take a minute and kind of like a chat, just put in something that you haven't seen.
Yes, stupid.
So let's see. We haven't gotten many answers there yet. Let me just ask, does anybody have a question for Courtney Barnard and Cook Children's? Cook Children's, to clarify their role, they have partnered with Asthma 411 since 2017. And when we saw the reduction in the 911 calls related to asthma, and we were monitoring that asthma-related attendance gap, that seemed to get, we had evidence that was getting narrower. We formed our consortium, and Cook Children since then has very generously provided the pharmacy services, the medication, the supplies, and pulse oximeters. And a key element, we have become aware of some systematic biases in many pulse oximeters, where the more pigmentation and melanin in skin, the less accurate they are. And we're delighted that we brought that information, looked at it together, and Cook Children's Pharmacy has identified a model that is robust and accurate across that variability and is making it available. So I would love it if there are some questions. Any questions for Courtney and Cook Children's? I'm going to go ahead and close out that poll. Anybody has any other resources and comments you'd like to make, please go ahead and put it in the chat. Here is another one. How about challenges? And I am selecting this to launch. A poll has been launched. What challenges do you see to implementing unassigned albuterol? And I hope folks can see that, and we'll hope to get some responses on that one.
If anybody is not seeing the poll and just wants to type it in the chat, that is perfectly fine as well. Leslie, while we have people who might be putting in their questions, I have a question for school districts that are not in the Dallas-Fort Worth area, who might not have partnerships with Cook Children's, or in areas where there might not be a pediatric Goliath to help, to help provide those kind of resources and services. I don't know if you or Courtney wants to chime in on if that's something that you guys can help with, or if you have any ideas or suggestions for smaller places outside of metro areas.
I can give a quick answer on that one. And I would say that one thing to be aware of is that the estimated expense for just the MDI and the spacers are about $50 to $75 a campus. Now, if you prevent 1 or 2 absences per campus, and we have so many kiddos who let us know, gosh, or their families have let us know, Jose's asthma wasn't great this morning, and I knew I didn't have the inhaler to send or the paperwork in place, so I just kept him home. That can be recouped, and we have some estimates of how the financial savings play out, which can be compelling. I think I can certainly work if there's a school district that's very interested and wants to be a part of that. If they're in our catchment area, and Courtney, I'll let you speak to that, you certainly can reach out with the Kirk Children's area. Safer Care Texas may also be able to help some districts with some piloting if they've got an interest in doing that. So I will go ahead and open that up to Courtney or to anyone else.
Thank you.
I'll piggyback off of that. And
Yes, we're always open to having conversations if you happen to be in Cook Children's primary service area. That's helpful for us to um, include that in our considerations for establishing new partnerships outside of what we already do with the Tarrant County Asthma 411. So I can put that in the chat too, if you're wondering what that is. But I do see in the chat that some challenges being you don't have that partnership with an institution that can provide medications or the cost of the medications. And so, you know, for us, what worked well in our area with Cook Children's being the pediatric healthcare system in the area, of course, that was that made us one of the first stops. Another thing you can consider is looking for healthcare systems who have a nonprofit status, as we do here at Cook Children's. Healthcare systems with a nonprofit status do extra work in the community. Some of that community give back. It's part of their work and part of the requirement to keep their nonprofit status. And so that's an opportunity. That's how we were able to connect it and secure this long-term partnership and funding to support this effort, is because we have it tied in with that. It's called community benefit. Is the term you would use. So that would be an option, but the costs really are not, I understand the costs are high if you don't have that in your line item, in your budget line item already. But for larger institutions, they're really not that costly in terms of what you get back in terms of the impact and health outcomes for the kiddos. So it's a strong argument for funding, whether you get a private, private funding or go to a corporation for support. But the pharmacies need the prescriptions, and any pharmacy can fill a prescription if they're willing to do that. At the school level.
And I think those are some of the pieces to this that we realize we'll be working to add out over the course of this coming year is some of the information about the policies. And, with the children's, we've been working on the whole process of communications around keeping those medications ordered and distributed, and how one disposes them. And so we know that these are pieces that we've kind of grown into, but we can certainly make them more readily available and put those as resources on the website as well. It does look like, even though the poll is showing that it's launched, it's not visible to everyone. And so I'm going to just go ahead and read some of the things that have come up in the chat. So the resources really seem to be a concern for folks. And I will let everyone know that, there is the Texas Asthma Control Collaboration. It is my hope with Texas School Nurse Organization that, we can really think about implementation. I wonder if putting together a short presentation that people could share with a community stakeholder would be a useful thing, so that they could have a sense of what those costs are. If we want to send an email to us or to put it in the chat, yes, by all means, let us know, and we can try to have that conversation. Charlie has let us know, it's in the chat, that the American Lung Association also has a number of online training resources about asthma, and those are extremely valuable resources. And in fact, we have a little snippet of the American Lung Association. We have incorporate that because they do such a wonderful job. Of course, I'm watching that. I will say one of the other wonderful things with Cook Children's is that they have been providing an annual asthma symposium for school nurses, and because that is now virtual, If you are interested in that, I think you could put that information in to Courtney with Cook Children's. We can share that. And you can also email us at asthma411.org and we can share that information. It's a virtual and we can open that up to anyone who is interested. Courtney, I know you had a wonderful response last year. I think you had over 350
On the call. And it reached 600 people were interested and followed up afterwards, or total follow. So another 300 afterwards. So it had a great reach in the state. So we make the topics applicable to anybody, not just those participating with our group here locally.
Absolutely.
Carly, I'm gonna put American Lung on the spot. No, I'm kidding. In previous years, our school district has been able to partner with American Lung Association. Every once in a while, they'll open up these mini grants for schools to put in different initiatives and different plans. You share your plans with ALA and they can provide funding for some stuff. Additionally, because I know money is always an issue for school districts. And a lot of people are saying that they need to be able to find a position that would provide a standing order, right? Which would also require them to provide some type of supervision. Even as distant or passive as that is, I would recommend for our rural areas to get in touch with your county or region's emergency medical services director. EMS follows a set of standing orders that are signed off by a physician. They follow doctor's orders just like nurses follow doctor's orders. And considering that we would be helping for their long lead times, if we had somebody in severe distress, we would be buying them some time to get there. We would also be eliminating the need for them to take an entire vehicle out of service to come give a kid a breathing treatment at school and then close the doors empty and drive away, right? That's not dollar productive for them. It's not best for kids. I think most of those medical directors would be quick to jump on the chance to help a school district offer this service. I don't know necessarily that there would be county money there, but it's always worth the conversation.
You know, I just want to add that in our circumstance and situation, that the range of, I think Becca's point is wonderful. If you don't get that answer you need there, consider other potential stakeholders. In our circumstance, we had an opportunity to present our initial pilot results, which was 2 schools for 2 years, to our county commissioner and county judge, Judge Jean Britley. And he was the one who then pulled together our community and said, let's remove the barriers to any school district in our county that would like to implement a program like this. And, you know, Courtney, you can, you know, add to that. But I think that finding somebody in your area who can be that kind of a champion. I mean, it's great when you've got that person in the healthcare system, if you can reach out, that's fabulous. But there may be somebody else who can just help motivate and mobilize those resources. Helping children breathe is such a fundamental need. And I think it's something we've mentioned. It's a wonderful area to be working in. And if asthma is so prevalent that you talk to 10 stakeholders, probably one of them either has asthma themselves or knows somebody who does. And really, when people started to hear that for $50 to $75 a campus, this could be done for a year, they really were motivated. The other thing is that we're pretty early on in trying to see how do we support implementation at a state level. And I think every person who's on these calls really encourage you to reach out to that asthma411.org or to me individually. I can let you know. We will use, build with this to find new ways to seek funding and support. These answers have been identified with stock epinephrine. It's not going to be the same answer for this, but we can look and see how can we better find funding that will support any school district and remove the barriers to those districts that want to implement. We have one question from a participant who is new to nursing, relatively new to school nursing, she says, and asks, does this mean people have to make the unassigned albuterol, this NDIs and lighter spacers, or another assignable spacer, can be any kind you wish, available? No, it's just that it's an option. And the law provides one of the important things, along with it specifying the training and the documentation, it provides very robust liability protection. And there's recognition that concerns about liability can be a barrier to folks, even though in our 20 years of experience, I'm not aware of any liability or adverse outcomes. It's a concern, we know that. And so the law does protect the school district, whoever administers the medications, school nurses, anyone involved with training, anyone who dispenses, anybody who prescribes, as long as they are acting in good faith to protect the health and well-being of customers. So I have tried closing out the polls and reopening them. And for whatever reason, I see they are still not launching, so my apologies for that. But we can just ask the questions as we go forward. And please keep putting your answers in chat. We've had some people who are asking about information to send to them. I would be happy to do that. And we can also, if your chat does any virtual meetings, please let us know and we can try to put together some information from that perspective as well. I've had a couple of school districts, some of them in some far southwest Texas, who were interested, and I was delighted to be able to join their chat meeting and talk a little bit about this, answer questions, and I think our partners with you will to do that too. It's our hope that with all the wonderful steps that have been taken to get the policy in place, we want to continue this partnership to make implementation as available as possible to those school districts who want to bring it to the communities. I've got another question or comment has just come into. Okay, so this is an important question that Becca has brought in, and I want to go ahead and to address it. That is that it can be a concern that parents are going to be over reliant on the medication and be incentivized to bring in their own. This is a concern. There's no doubt about it. It involves a concerted effort. We do have some resources that we have developed over time to help that conversation with parents about it. For example, the frequently asked questions, you can make it very clear that, does this mean my child does not need their own medication? No, it does not mean that your child doesn't need your own medication. We need your medication authorization and your asthma action plan and the medication of your own, etc. So I will say that while nurses encounter this, and I think, of course, because this is a challenge, and this is part of our school health landscape that we live in. Overall, on our nursing surveys, nurses have an overwhelmingly positive response and have indicated that overall that it has improved every element of not only the urgent care, but also their ability to have a conversation and engage with parents about the needs that they have for improving their asthma management. I have just put in the next slide, and this will be my last one that I'll put up here. This is just an overview of our outcomes, and I'm kind of generalized it over time when we see that with the standing delegation order of disposition, about 80 to 85% were able to safely return to class and complete their school day. That's been constant over the years. It was a little bit lower during the pandemic. It's come back up a little bit higher now, and it's actually what's been seen in Arizona and Illinois as well. 15 to 20% experience an early dismissal to the parent and family with a recommendation for same-day care, and fewer than 2% require the EMS. We have done this kind of speaks a little bit to the questions about the resources, and we've done the best with available evidence on how we can get an estimate of cost savings. And, you know, a lot of this, of course, the cost savings comes to the asthma-related EMS calls. And unfortunately, we can't directly use that medication to buy the supplies or perhaps support more school nurses and school nurse services and outreach, which we could. But having this kind of information may be able to support that dialogue with the emergency medical service providers and others, as Becca had mentioned. Again, we also have a nursing survey every year, and we're very close, between 95 to 98% of nurses and health staff indicate that they're satisfied or very satisfied, that it's manageable or very manageable within their school schedule. That's gone down just a little bit as we have more documentation requirements coming in. And one of the biggest concerns, the two biggest concerns people identify is completing all the documentation that's needed. And secondly, connecting with parents, which we know is hard, but it's not limited to asthma. So let me just see, I am going to invite, I think that we have, let me just ask if anybody would like to have that chat presentation and get a sense of how many people, you know, who would be interested. If you want to go ahead and put your name in chat and indicate that you'd like to have that follow-up message, we'd be happy to do that. And I can also connect, we'll be sharing the course with Charlie, with Courtney, with Becca, TSNO, and we can see how can we begin to strengthen structures for collaboration in the state and make this more accessible to everybody. Another point has said that, you know, yes, it happens that parents may not bring in the medication, but in the long run, it's best practice to have the medication when it's available. It is a tough question. You know, a point that comes to mind, well, two. One, no child must ever be dependent on quick relief medication. And that's what makes the outreach and the follow-up so critical. We try to have those supports there. But secondly, when we think about how do we get parents involved, hopefully we can have consensus. It isn't about not providing, helping kiddos breathe when they're struggling at school. Okay. Also want to point out, thank you so much. Cindy is here, Trubisky, from the American Lung Association, and has a new training launching for school implementation. Stay tuned. Cindy, would you like to say a couple words about that?
Hi, everybody. Can you hear me?
In on that, so don't mean to, thank you so
okay.
much for being willing just to step in spontaneously.
Oh, no problem. Can you hear me okay? Yes. Okay, so I dropped the link in there as our primary hub for all information around asthma and medication at schools, or access to medication in schools, including some standard model policies and trainings, as well as our self-management education programs and our resources. But the exciting news is that we have a new toolkit of resources coming out on this topic for supporting states that have legislation in place. It includes all of these key pieces, as well as a major training for school health, clinically licensed and designated individuals. So we're excited to say that it's following the research that happened and working. We have a stakeholders group that's working with many of the states that are successful, including, you mentioned, Arizona and Illinois, as key drivers to what is working and giving recommendations on that. They are also in the process of helping us review and launch that program. So the program, I can't give you a specific date, but it's coming soon, and it should be in the next couple months, because we're really excited to have it for our back to school timeframe. I also have another colleague that's on the line today. If she wants to add any commentary, you're welcome to. Barbara Kaplan.
I think you said it perfectly, Cindy. I don't know that I have
Thanks.
anything else to add, but yeah, looking forward. Actually, you said 2 months, but hopefully it's 2 weeks. I hope that our training launches in 2 weeks.
Right, I wasn't going to overpromise there.
Yeah.
Great news.
Excellent.
But we're happy to help and answer any questions.
That's great. That's very exciting for school nurses as well. Somebody mentioned in the chat, they heard the standing delegation laws were being talked about. Yes, stock albuterol laws are what we're talking about. You're right. The orders that we would need a physician to write a prescription for us to be able to obtain the medication, right? Because it's a prescription medication. And also standing delegation orders for school nurses to administer that medication. Now, it would be the school board policy and the school policy that would allow other people in the school district to administer this medication. But regardless of whether there's a nurse in the district, you would still have to have a physician's prescription to obtain the medication. So yes, the laws are about stock albuterol. The prescription is to get the medication, period. The standing order would be for the nurse to administer it according to the doctor's order, and any other layperson would be assigned by the principal or whoever is making the assignments on campus to administer that medication as well, since they don't have to follow a doctor's order. They would follow the policy. I hope that makes sense.
I had muted myself. There's some good structure going on. But I want to appreciate, say thank you to the individual asking that call, asking that question, and just having that clarification. And it is, for example, that the delegation is coming from your authorized prescriber or physician to the nurse or the school district. It isn't the school nurse who's doing the delegation. So thank you very much for that important clarification for everybody. I've had a whole lot of folks who are saying that they're interested in this check. So I'm really excited about that. And I'll look forward, hopefully all of those on the call can kind of share this information, and we'll see the best way that we can provide the support and information people are interested in. We've got about 4 more minutes before we hit the 1 o'clock, and I know some folks need to move forward. But I just want to ask if anybody has some questions for some of the school nurses, Rachel Rivera and Sarah Hiraman, and my apologies if there may be some others who are on the call who have been implementing in our area for some time. If you've got a question for them, or if either of them just have a comment about their experience, that might just be a note to close us out on. So feel free just to unmute yourself if you have a question. There's no auto mute here, just go right ahead.
Hi, I'm Rachel. I don't have a question, but I'm a nurse practitioner working with Northwest ISD and partnered with Asthma 411. And I just want to say thank you. Thank you for working with our district. And we're just so grateful that we have this communication on campus.
No, Sabrina and I had been texting her off and on about.
So anyways, Leslie and Courtney and just everyone that has worked so hard, we're grateful, and I'm excited to continue working and helping students.
Thank you, Rachel. And Rachel and her team have been, the team in Northwest are doing a lot of wonderful work. We've had some limited capacity to do so many challenge grants and support districts, in addition to the wonderful support group for children's, but building out those best practices that we know are just really, really tough to make happen for every student. And so Rachel's group has been a part of that, and again, has this wonderful program that they're developing, and all of this helps through our learning collaborative to see how we can best mobilize the resources we have to do what we know works to improve outcomes for children and help them learn better and breathe easier during the school day. I'm gonna leave. We're at 12:58. I'm gonna leave the chat open again. If somebody wants to have that last enter into the chat with either a question or simply letting us know that you would like to have a follow-up information or a presentation with your chat, we can try to get those scheduled. Please go ahead and put it in that chat, or feel free, again, asthma411.org. And I'm Leslie Alsop at UNT Health Science Center, and I'm sure that Charlie and Becca would be happy to be in touch as well. And I look forward to how we can continue to strengthen our collaborations to best meet the needs of kids in Texas. Thank you all so much for joining, for taking this time. Thank you so much as we get ready to open the doors to children for another academic year. Those in school health are my real heroes, public health heroes, and we're so grateful for what you do every day for children.
Well, Leslie, on behalf of school nurses, I want to thank you for your leadership on this. You are always, always, always looking for ways to put other people together and just strengthen the voice that we have in Texas and get the word out and help kids all over the state. And I just really, really, really admire and appreciate your leadership. So thank you, Leslie, for getting us all pointed in the right direction.
Thank you. And thank you for every single person here, and to Charlie and our ALA partners, to Courtney, and to all TSNO. Thank you all so very much, and have a wonderful day. We'll close it there, say goodbye, and look forward to our next opportunity to connect. Thank you.